Now, cardiologist at SLU Care and SSM Health SLU Hospital. You were in Denver. Was it Denver where this conference was?
Denver, yes.
Denver, when this conference last week released some sort of really interesting information about stents, the good and the bad. What happened?
Well, there's nothing more fun than controversy, I guess.
Yeah.
So, a week ago tomorrow, last Thursday, a very, very, very interesting and unique study was released where patients from the United Kingdom were with simple coronary artery disease, or simple blockages, most of the time single vessels. A lot of times the more complex stuff means that we have multi-vessel blockages or multiple blockages. So there's simple things. Got into a study where they were put into a 6-week intensive medical treatment phase. That was handled by a single, very dedicated doctor there. And then they were randomized to either receive a stent to relieve that blockage and improve blood flow, or to undergo that procedure without the stent, meaning what we would call a sham, which means sort of a placebo.
Okay.
And the patient and the treating physicians didn't know who got the stents and who didn't. And then they followed them for 6 weeks. And they looked at trying to figure out exactly, what possible benefit can you get from a stent over and above medical therapy. And, it's the good, the bad, and the ugly. So the good news is that the folks who got a stent actually did exercise for longer periods of time than the folks who didn't. And they had more relief of their symptoms, their chest pressure, their chest tightness, what we call angina or heart-related symptoms. The bad news is that when we do research, we sort of set bars of which we want a specific difference. So in this case, it was 30 seconds more of exercise was going to be meaningful, meaning the stent actually provided a significant benefit, which is just a statistical term.
Right.
And they didn't quite reach that. And so the actual study had to be concluded as negative. But there's a lot more information, a lot more dirt into it, which gets us into the ugly, which
Right.
is now we just get this study potentially over-sensationalized in our world of, stents don't do anything.
Right. Welcome to our world.
And that's why I think it's important to talk about it and make sure that we just put this study in its place, which is not the be-all, end-all study in any way, shape, or form.
All right. So as a cardiologist, you're the perfect one to talk about all of this.
Thank you.
What should we take away from this study, and what do you take away from this study?
Well, number one, I hope that people gain a lot of confidence in the cardiology community, and especially the interventional cardiology community, the people who put in stents, for our colleagues taking on this type of study, saying, we really want to know what this does. And we're willing to have patients undergo a sham procedure to really figure out, well, where's the benefits and where aren't the benefits? That's a great question. The only way we answer these questions is with research.
Right.
And so there should be some confidence that we're willing to take on tough questions
Right.
and answer them. Number two, there's different types of afflictions with coronary disease. People are having heart attacks or potential heart attacks and fall into an area we call unstable angina. It has nothing to do with this study in any way, shape, or form. In unstable angina, and especially in a heart attack, stents have already been proven to save lives and prevent further heart attacks. The problem is that it's hard to differentiate that from if you had, let's say, an 80% blockage in one of your arteries right now. And you say, wow, okay. You might not even know it today. At some point in time over the next couple of weeks, if we go jogging around Clayton because it's beautiful, and you start developing some chest discomfort, then you get a stress test, then you get a cath, now you find an 80% blockage. Now your whole life is turned upside down. So I have this 80% blockage.
Right.
And the average person says, okay, I got it, get rid of it. Put a stent in it, get rid of it. And the unsaid thing behind that is that cures me. The problem is the blockage.
Right.
If I put the stent in, I'm cured. The answer we already know without this study is, no, that's not true. We don't have a cure for coronary artery disease. We can give you more blood flow, which can help you run farther,
Right.
help you walk farther, like in this study, or help you be more symptom-free. But we need to treat you with medicines to prevent these things from continuing to happen.
So you can't continue to eat the cheeseburgers and the fries all day long and the Chili's cheesesteaks and continue to think everything's going to be good.
Well, that's some people's choice, but it's probably not the best choice.
Right,
correct?
right. Yeah. But not changing your lifestyle and just getting the stint
Yeah.
doesn't necessarily mean you're solved.
So, exactly true. The stent is not the easy way out, and it's not the simple solution. And for that matter, even though bypass surgery is not necessarily an easy procedure to undergo as a patient, it's also not a cure for the same type of deal.
Right.
What it can do is it can give you much more blood flow to the heart, which can improve how you do, but you still have the other part of the package where you have to take the medications that work on the disease process itself. We talked about those cholesterol-lowering ones and
Right.
other things like aspirin, and you got to change your lifestyle, or you're going to get right back to where you started.
Right. There you go. That's why you go behind the headlines with Dr. Michael Lim.
right.
Cardiologist with SLU Care and SSM Health SLU Hospital. Thanks. Good stuff, and thanks for coming in.
Thank you.